Brilliant, that's recording now. So thank you everyone so much for taking the time to join the webinar today. Thank you for kind of being part of this Stop Smoking delivery, or if you're kind of new to this service, thank you so much for taking the time to find out more and potentially join us going forward. What we're going to cover today is everything around kind of You Lincolnshire, our Stop Smoking programme, and kind of what the role is that we work with you guys for to deliver this out within your community networks. I'll just do a quick introduction before we get started. So my name's Teresa. I am the smoking cessation lead at You Lincolnshire. So I oversee kind of our team of stop smoking practitioners, but also our telephone kind of delivery, and obviously you guys out in the community delivering on a subcontracted basis. I'll pass over to Kirsty to introduce herself.
Thank you. Hi, yep, I'm Kirsty. I think some of you have met me already out there. I can just hear myself bouncing back, I think. I might have to mute everybody, Teresa, if that's okay. Let's just see. Are you able to do that for me? Thank you. So I work as a stop smoking external engagement project lead, and I job share with Claire, overseeing all the practitioners across the county. So we've trained everybody up, and then doing visits and promotional days, a bit of all sorts really. So I'll lead on to Claire.
Hi, I'm Claire. I recognise some of you that are attending today, and you probably recognise me from my visits. I've been a stop smoking practitioner for about 3 years now. So I have my own clinic, and I also support our subcontractors out in the community who are delivering the programme for us. So that's how I get to meet a lot of you out in the field. That's me.
Thanks so much. So yeah, I'm sure lots of you will be familiar with Claire and Kirsty, and they are kind of always on hand for if you've got any queries and in the day-to-day running. And obviously, if you do are going to start with us in the future, Claire and Kirsty will be there to offer a lot of support in your delivery as well. So I'll run you through what we're going to cover today. A little bit of an overview here of what to expect. Please do pop any kind of questions or thoughts in the chat, which we'll be kind of monitoring as we go through. And then, as I said, we're going to have some time at the end as well for any questions that you might have. And we'll also pass on our contact details if there's anything you wanted to contact us kind of outside of the webinar as well. So we'll go through a bit of an overview of what the You Lincolnshire service is, because stop smoking is one element of it, but we are a wider integrated healthy lifestyle service as well. What the stop smoking programme includes, the overall formulary of the NRT products that can be offered to residents of Lincolnshire, and then the kind of the overall role of a stop smoking practitioner, the benefits of delivering the programme, what you can expect and the support you'll receive, and then obviously some next steps from here as well. So overview of You Lincolnshire, as I just mentioned, we're an integrated healthy lifestyle service. So we're commissioned by Lincolnshire County Council, and we were first commissioned in 2019. So that was in 1st of July 2019. So we are just about to roll into year 6, which we're really pleased about, that we've been able to kind of make some sustained changes for the residents of Lincolnshire. So obviously we are all aware, or hopefully aware now, of the stop smoking element, which I'll go into in a little bit more detail today. But just as an overview, we do actually offer free programmes to Lincolnshire residents, or those that are registered with the Lincolnshire GP, or those that work within Lincolnshire, because the contract really tries to kind of include as many residents as possible, particularly when you look around those border areas where someone might kind of live within, say, Nottinghamshire, but actually they're registered with a GP in the county. So we offer weight management programs, and that's both for adult and also child and family. We offer physical activity or move more programs, alcohol reduction advice, a strength and balance program, which is very kind of relatively new, and it's our falls prevention program. And then there's also health coaching as well. And within all of those different pathways that you can see there, there is a range of different programs to hopefully suit kind of all different individual needs. So there's kind of digital options, there's face-to-face options, there's group delivery, one-to-one delivery. So we really try to be flexible and meet others' needs. And where this might be kind of really relevant to yourselves out kind of in your place of work, is that you might then be able to refer clients or patients onto these other pathways, whether they've come to you to talk about their smoking, but actually they identify that they'd also like to work on something else. You could also onwards refer them to any of these programs, or they can also self-refer onto these programs by using the One You Lincolnshire website or telephone number as well. And lots of the details about what's within each of those programs can be found on the website if someone is wanting more information. So what we're talking about today, obviously, is the Stop Smoking programme. And as you can see there, we have an annual target at One You Lincolnshire of 2,675 4-week quits per year. You may be aware that Lincolnshire does have quite a high smoking prevalence, so this is a really important pathway to be offered to Lincolnshire residents. And you guys that are out there doing it already have done a fabulous job. As we said, we're coming up to the end of the 5th year of this delivery, and we did hit this target last year, or exceeded this target. So some really, really brilliant work happening out there. But overall, the programme covers a 12-week span. And obviously, some of those key points within there are that 4-week quit when someone has reached their 28-day smoke-free, and then also continuing that support up until a 12-week point for that really kind of sustained quit, and hopefully then giving someone the best opportunity to carry on life from there smoke-free. And within that 12-week programme, there's the one-to-one behavioural support, which is where you guys come in, and also our team at One You Lincolnshire, to offer that kind of motivation and some coaching around kind of being smoke-free. And then also providing free quit smoking aids. So that's things like nicotine replacement therapy, which we're going to go through the formulary of today, e-cigarettes, and also stop smoking medications that can be prescribed as well, which at the minute extends to Zyban, that some of you might be familiar with. And then we offer things in face-to-face clinics, such as carbon monoxide readings. So this is something that is a really kind of motivational tool for clients. They might come in session 1 and blow into the carbon monoxide reading and get quite a high number on there. And the machine sometimes starts flashing red as well, if you've seen that. And it really kind of shows to the client, is a great talking point to show that actually when they are smoking, they are inhaling this kind of poisonous gas. But on a really positive note, when they come back to you next week, if they've kind of taken on board these changes and been able to not smoke for that week, they will actually see that number go straight back down on the next time they do a reading, which can be really motivational to people that they are making a difference to their health. And it's always nice we can provide people with a certificate at a 12-week smoke-free status. I don't think any of us are ever too old to get a pat on the back and a little bit of recognition when we've worked hard to achieve something. So the certificates are always very kind of warmly welcomed from the clients. So I've kind of mentioned in the overview there that we have quite a broad formulary of products. So for any of you that are already delivering this, you might be quite familiar with the different NRT that is on offer. But essentially, we agree these products through the Lincolnshire Smoking Cessation Prescribing Guidance, and it is all passed through kind of the PACEF process, and with Lincolnshire ICB and also Lincolnshire County Council. So across Lincolnshire, there's a range of nicotine replacement therapy, both kind of long acting and also your short acting NRT. And within this programme, we're really fortunate in Lincolnshire that clients can be funded to have 2 products throughout their 12 weeks. So they can have the patch plus a secondary NRT product completely free of charge. So it's really trying to take away any barriers that people might face to quitting smoking. And if you think about when you're trying to find out what their motivations are to quit, particularly I think in nowadays kind of climate, people are saying more and more that their motivation to quit smoking is kind of financial because of, rising costs of everything and the cost of cigarettes. So from day one that they sign up to your program, if you're providing these kind of nicotine replacement products, they're going to start to save money for themselves as well because it's provided free of charge. So on this tiny, tiny screen that you can't really see kind of from your end, but I'll talk you through, this is essentially what it looks like in the formulary, basically showing that all nicotine replacement products that we offer have been marked as green in Lincolnshire. So that is your kind of long acting, as we've talked about, which is the patches. So we offer 3 different brands across this formulary, which is your Nicorette, Nicotinell and Nicotin. And all of those patches also come in 3 different strengths. So your Nicorettes are in the 25, 15 and 10, and the Nicotinell and Nicotin are in 21s, 14s and 7s. Don't worry, by the way, if you're not used to this, you don't have to remember all of this off the bat. You get lots and lots of kind of support with this, but essentially showing the message that we've got lots of options for clients. So it's not one size fits all. It's all assessed through their kind of smoking habits and kind of smoking levels, so they're going to get the right amount of nicotine to help them through a program. But also with the different steps of patches, it means that you can help them reduce their nicotine use throughout the 12-week program. So at the end, not only are they smoke free, but they're also nicotine free. So they haven't got that addiction, and it gives them the best chance of staying smoke free at the end as well. And then, as I mentioned, really fortunate here that we're funded so that clients can receive 2 products for free. So with that patch, they can also have a secondary NRT product, and that's the sort of fast acting or short acting NRT, which people can use throughout their day-to-day life when they get that craving. So that might be things like the gum, which comes in lots of different flavours. We've got lozenges, mouth sprays, nasal sprays, lots of different things there, inhalators as well. So again, it can be kind of catered to that individual's needs. And you might find that clients sometimes kind of switch product as well. They might come in at the start of the program and say, yeah, I absolutely love the idea of a nasal spray. I think that will be brilliant for me. And actually week 2, they come back and they say, I hated that. I really didn't get on with it. It didn't help me with my cravings at all. You could actually then change that product for a different secondary. So again, we really want to think about removing all barriers to people's stop smoking journey and making it as easy as possible for them. You can see on here that there is also the kind of medications or prescribed medications for stop smoking, which I will come on to in a second as well. So from October 2022, One You Lincolnshire were also able to introduce e-cigarettes as a stop smoking aid. So e-cigarettes are viewed in the same way as the secondary NRT products, so short acting. So these can be used in combination with a patch, or they can be used on their own, obviously. And again, that comes down to kind of client preference. This had to go through the same process as the other NRT option. So it went through the PACEF committee and the Lincolnshire ICB, and actually the kind of Lincolnshire maternity services and mental health services are working to use e-cigarettes as stop smoking aids as well. So this just adds another option to a client as their stop smoking aid. You've still got your formulary of NRT, or you've got your e-cigarettes, or you've got your prescribed medication. It's just about building up that kind of wider toolkit of products. So as I said, we ran through a 6-month pilot from October 2022, and that was just within the kind of One You Lincolnshire stop smoking practitioners that we employ directly. And the reports went back to kind of Lincolnshire County Council and the ICB. And after that, because it was already in use in LPFT and mental health services as well, and that ULHT were going through the procurement process, it was deemed that we could continue using these products, which has been a really kind of positive option for clients to choose. A lot of kind of research and thought has gone into this, and obviously now NCSCT, which is the National Centre for Smoking Cessation Training, have produced lots more guidance on helping kind of healthcare professionals use e-cigarettes as a quit smoking tool, and also how important it is to get those messages across accurately of what they're being used for here. It's for those that were smoking tobacco products and are using this to help them quit. It's not there to encourage people to take up vaping if they weren't doing anything previously. And as you can see there, NICE guidance and Public Health England regard it as 95% less harmful than smoking tobacco. You may have also heard kind of at government level, there was a scheme introduced last year, which is called Swap to Stop. So this is essentially a nationwide programme where they offered 1 million free vapes to stop smoking services and the NHS to again remove barriers and offer this as a quit aid for those looking to stop smoking. So again, we were able to utilise some of those free devices to support the expansion of these e-cigarettes throughout our programmes. And we have a provider called Totally Wicked. So it's only one e-cigarette device that we offer, with, again, a range of nicotine strengths so that it mirrors the other NRT products that we use, so that you can therefore support someone to wean down their nicotine use throughout the 12-week programme in the exact same way as any other form of NRT. And they are rechargeable devices, so we don't offer any disposable vapes, obviously because of the they can contain higher nicotine or have less variation in nicotine strength, and also due to the environmental effect that it can have as well. And we have developed a specific training session for practitioners. So as this is something that your location is looking to offer, we have specific in-house training as well as training from the provider as well. Okay, so another thing within your toolkit, like we've mentioned, is prescribed medication. So if you've been doing the stop smoking for a little while, you might have used Zyban in the past. The kind of main stop smoking medications that we've had is something called Champix and also Zyban. Both were removed from the market a couple of years ago due to investigations into certain chemical levels within them, but Zyban has now returned to availability at the end of last year. So this offers something to clients if they are looking for that prescribed medication route on their quit smoking journey. So you can see here again, this has all gone through the Lincolnshire prescribing guidance and it is back on available. And we started using this again within our One You Lincolnshire team of practitioners back in January. And then again, we have developed a specific training module for yourselves as practitioners as well, so that you can have either a refresher on this if it's something you've done before, or if it's brand new to you, all that information's included as well. But essentially, it is a tablet that can be taken to help someone kind of suppress those nicotine cravings. I've put a little summary there on the slide around originally Zyban was not created as a stop smoking medication. They actually found it as kind of a side effect, was that people no longer crave cigarettes, and that's where it has been kind of licensed over the last few years as a stop smoking medication. It does, however, come with a list of contraindications. So there are client groups that won't be able to access Zyban. So, for example, it might be those clients who are already on certain medications, particularly clients with who are on mental health or depression medications, anything like that. But it's all covered within the training, and we also go through some real kind of strict screening questions before this would ever even be sent on to a client's GP. But with it being a prescription medication, the way that we run it in Lincolnshire is if a client was deemed suitable for this, you would fill in a prescription request letter. This would be sent to the client's GP and then they would prescribe the Zyban if appropriate. But that client would continue to come and see you for each of the 12 weeks because that behavioural support is still really important. And then we obviously reimburse the medication cost because, again, it's at no expense to yourselves or to the surgeries or the ICB. That comes through the One You Lincolnshire contract. Okay, so all of those, that covers kind of the options that are there for people to stop smoking. So what actually is the role of yourselves out and about as practitioners? So obviously it gives kind of staff within your teams the opportunity to kind of upskill in another area. So the stop smoking might be kind of an additional role that someone does within your practice for that development, but also to offer another service to your patients and your community. So part of this role, what does it include? Well, it's delivering the 12-week programme that we've just mentioned. So that is those face-to-face appointments for a 12-week span and carrying out those carbon monoxide readings. And again, we provide you with the monitor and all the equipment you need, so it's at no expense to yourselves. There's an initial appointment of 30 minutes, and then the rest of the 12-week programme has weekly appointments for the first 4 weeks, ideally. And then clients might drop down to fortnightly appointments. If they're getting on really well, they're feeling motivated, they're feeling confident, they might then not need to see you every week for the remaining 8 weeks of the programme. you're going to be offering them that behavioural support and that motivation and kind of reassurance that they can continue with this change. And like we said, you'll also be providing the nicotine replacement product or the medication that we've mentioned to support them on their quit. And we reimburse all the costs, which I will come on to. And then there is also the added incentive of we pay per activity and result on this. So there is payment for the quit outcomes as well as the reimbursements. So again, we appreciate the time that goes into this from your staff and yourselves out in pharmacies and surgeries. So there is that kind of payment as an incentive as well. As we've kind of mentioned through this, and hopefully some of you, if you are already delivering or you've got staff that are delivering, you have seen some of these benefits to the programme, but it enables your pharmacy or surgery to support the local community in another way. And we know that kind of members of the public will trust you guys as sources of information and support, and they might already be coming in to see you for a number of reasons, whether that's health or mental well-being. So actually this is another service that they know they can trust from you in their community. It provides an opportunity obviously for staff development that might be outside of their day-to-day role. It can be that additional responsibility. And as I said, it is a paid by outcome model. So what that means is that per client, you could receive up to £80. And again, I will go through a breakdown of how that £80 comes about as well.
Something in there, like £30, £6.
There is also, like I've said, reimbursement for all the products and the equipment is provided by us. So it should come at no cost to yourselves. And the really key thing here, like I touched on with the local community, is it is direct contact with that client, that customer, which removes the barrier of them having to maybe think about their stop smoking quit and then come and sign up with One You Lincolnshire themselves and then get in touch with us to make that appointment. You can actually kind of strike whilst the iron is hot. They might be there at your desk or saying to you about how they've been thinking about quitting smoking, and you can kind of make every contact count and get them started there and then. And obviously, quitting smoking may link to a lot of health conditions that the clients or patients might already be coming to see you for. So whether that's that they're coming for their blood pressure checks, for example, and they've got high blood pressure, actually, if they are a smoker, by quitting smoking, they may be able to have a positive influence on reducing their blood pressure. So there's lots of links that can be made with this and the other services that you offer. So what's expected from delivering this programme? So at the start of this, if you were to sign up any new practitioners, there is an initial training and then there is annual refresher training. So the initial training is 2 days and then the annual refresher training is just half a day a year. And that's for kind of any updates that might have happened in national guidance or Lincolnshire guidance. A bit of refresher of everyone's knowledge and skills, which I think we all benefit from. There's always little bits and bobs, even if we do this day in, day out, that we might forget or want to ask some questions about. And it also gives the opportunity for practitioners to kind of meet up with other practitioners and ask any kind of questions and check if anyone's seeing the same things that they are as well. It will obviously, the programme we ensure follows NCSET guidance and our delivery guidance. And again, Claire and Kirsty are there to kind of support with any questions if anyone wasn't ever sure on that, and to kind of check in terms of quality assurance as well. We do have a software called Quit Manager, which is where all of the data for this is collected. So you would again obviously get a login to that as part of signing up to the programme. And we again provide all of that free of charge, and also the training on how to use that is included in the initial training days. Everything you put into there is obviously kind of a client record of their quit smoking journey, but it also is where we can pull the information to reimburse you and pay you for your delivery as well. So it's really important that that's updated kind of in a timely manner, and we ask if possible within 48 hours of the appointments, because it is a health record for that client, and we also want to make sure that we're paying you accurately and you're not out there delivering something that we weren't aware of so that we can't pay. And in terms of you being out and about in really key community settings, it's all about promoting that service, and the importance of stop smoking, and also being able to build that rapport and engage with patients and clients. Flexibility of appointments. So you might find that someone might pop in one day, they might be on their way home and they've popped into the pharmacy to pick something up, and you've kind of really caught them in that moment and they've signed up. But actually, for them, each week looks a little bit different around work. So it might be that they need to come and see you at different times of the day. So it's about kind of agreeing that with the client or the patient, but also from yourselves. I mean, we really appreciate that this might not be your day to day. This is kind of an additional role. So it's that flexibility for yourselves as well around what you're delivering and what your workload looks like. So if you have really kind of busy times of the day for key tasks, you've got the flexibility to book in appointments around those, and you can kind of manage your diary and your caseload in that way. We ask, if possible, that there is a space that is kind of private or confidential to be able to offer these one-to-one appointments, because it can really help with building the trust and the rapport with the client if they feel they can open up to you in a kind of private space. And also they might have kind of their key motivations for quitting smoking might be quite personal and emotional to them. And like I just mentioned there, just time within the working day to be able to offer consistent appointments to clients so that they can do the whole 12-week programme with you. And also a little bit of admin time to be able to put everything from your appointment into the Quit Manager system so that it's all recorded accurately, and then we can make those payments to you in a timely manner as well. On the flip side, and very important to you all, is what you will receive from us. So obviously, this, as we've said, is like an additional role or responsibility. You might be completely new to stop smoking. So by doing that 2-day training, staff will become a certified NCSCT level 2 stop smoking practitioner. Again, you do get a lovely certificate. Like we've said, we all love a certificate. So you do get that kind of qualification to take away as well. You'll get that annual refresher training, and you'll also get any regular updates on governance and formulary changes as well. So that would be fed through to you from ourselves. And we also put updates on the Quit Manager system on the homepage as well for you all to see. Again, nice and timely, if you can't get to check your emails and that sort of thing. You get this dedicated ongoing support from our team. So Claire and Kirsty really are those go-to people. They know this system inside and out. And you will kind of be provided with their contact details, and also mine as well. So if any of us are ever on leave, for example, you should always be able to get hold of one of us, or through our main One You Lincolnshire desk, if not possible, to kind of get us on our direct phones. But we will be there to support you with any queries that you might have. But also with kind of promotional materials and referral generation support throughout the year as well. So we've got some really key kind of promo times throughout the year. I don't know if anyone's heard of No Smoking Day, which is at the end of May, and we also have Stoptober, which you probably see on a wide national level as well, which is that really big campaign throughout October to encourage people to think about stopping smoking. But we will support with kind of leaflets, posters. We have some very kind of graphic resources, which is like a tar jar and a phlegm jar, but all of those things that we can help you to set up little promo stands or displays in your workplace to help generate kind of referrals of people thinking about stopping smoking and coming to have a chat with you, whether that's staff or whether that's clients and patients that might be within maybe within the reception area and that sort of thing. And after you've done your initial training days, Claire or Kirsty will also pop along to see you, to check in with you one-to-one, see how you're finding it, check how everything's going. And we will also advertise any new locations on the One You Lincolnshire social media as well. So to encourage people to kind of take a wander down and know that you're there if they need you. Like I said, we'll give you all those resources and the equipment, including a carbon monoxide monitor, and that means that you can do CO verification for your 4 and 12-week quits as well. Quit Manager will be provided as the data collection tool, and all the reimbursements will be made on a quarterly basis, as well as the quarterly payments for your outcomes as well. And just a little bit of feedback there from practitioners that have been through the training before. We try and make it as engaging as possible, so it's, tailored to the individual needs of people on the course. Obviously, there is the set guidance that we do need to go through, but we do lots of interactive parts where they kind of run through session scenarios, get to have a little look at how to update the system, and obviously have a lot of kind of Q&A opportunities as well. Okay, so the payment model. So as we've said, it is a potential total of £80 per client on top of the reimbursements of medication. So every client that comes into you for an initial appointment will set a quit date with you. And for setting that quit date, you get £5. So every single client that starts with you, there is that £5 that you will get. Then if clients get to their 4-week point and they have quit at 4 weeks, it's just a really key performance indicator for stop smoking. And it's really vital for the individual, because if you make it to 28 days smoke free, you're 5 times more likely to stay smoke free long term. So if they come in and it is a self-reported quit, so what that means is that the client tells you that they haven't smoked and you record that on Quit Manager as a quit, that is a £15 payment. If on that 4-week visit the client does a CO reading, so they blow into the carbon monoxide reader and they get a reading of 9 or below, which we would say is indicative of a non-smoker, that payment is actually then at £25, and it's what we would call a CO verified reading. And again, the client then stays with you. They go through the remaining 8 weeks of the programme. You're giving them the NRT and that motivation and behavioural support. And if they get to 12 weeks and they come in and tell you that they're smoke free, it would be a £25 payment. But if they've managed to CO verify it, so they've blown into the monitor, which we always encourage at all face-to-face appointments, you would actually get £50 for that. So as we said there, if a client goes through that whole journey and they CO verify, it's £80 for that. And we calculate these payments at the end of each quarter, and then that is paid to you in the next month. And that's where that Quit Manager system is really important. Similar, as we've said, is the reimbursements. So again, this is all built into Quit Manager. So every time you select an NRT product on the system and say that it's been given to a client, we download that report and then reimburse you the following quarter for all of the products that you've supplied. And you can see there, and this is all supplied to you if you're part of the programme, you get all of this within your service level agreement with all of these time periods. And Claire and Kirsty will also get in touch with you if they think there might be something missing, to give you opportunity to enter it in time, because we really want to make sure we reimburse you correctly and in a timely manner. But everything you put in is then reimbursed to you the following month. The only difference to this is the Zyban. This is reimbursed to the ICB within 30 days as well. So again, all of that you just pop onto Quit Manager and we do the calculation bits from there. Okay, so that gives you an overview of the programme really. So for any of you that are already delivering, hopefully it's just a little bit of a refresher there, and you can think about whether there's anything that you wanted to implement or ask us about, or whether you had any additional staff within your practice or pharmacy that might be interested in delivering. And if you're new to this, hopefully that's given you a little bit of an overview of kind of what you could expect from kind of partnering with One You Lincolnshire to deliver stop smoking services. So if you are already delivering the programme, you would have signed an SLA with us kind of within the last year or prior to that. But because we're about to roll into year 6 of the One You Lincolnshire contract, we will be supplying you with a new SLA, which will cover the next year. So please look out for that in the next week or so. We will just need you to kind of review that SLA, which there shouldn't be any changes to from when you've seen it previously. And then you can review, sign that and return to us, and we'd be really grateful for that. And if you are interested in delivering this programme for the first time, please contact us. You can contact us via this email address and we will share this with you as well. And that email will go straight through to myself, Claire and Kirsty. So it's good to use the joint one so that one of us can pick that up nice and quickly. And also if you want to chat to us one-to-one, we can supply you with our kind of work telephone numbers as well. And we do already have some new practitioner training dates booked in at the end of July. So if you are really considering becoming a practitioner, we can get you booked onto that as well. Thank you so much for all your time today listening to our webinar. Has anybody got any questions?
Hiya, I'm Jo, the practice nurse from Greyfriars.
Hi, Jo.
Previously in our practice, this service has been delivered by one of our healthcare support workers. Would that still be okay for them to do that on this programme?
Absolutely, yes. Any staff member doesn't have to be, can be clinical or non-clinical, can deliver this as long as they do the 2-day training.
Perfect, thank you.
Thank you.
If you didn't want to speak, if anybody wants to put anything in the chat, you can do. Or if you wanted to wait till the recording's finished, you're welcome to hang around at the end because we'll be here as well.
Brilliant. Thank you, everyone. Well, what I'll do on that note is I'll end the recording today, which we can circulate for you all if there was anything you wanted to check or you wanted to share it with anybody else. And then, as Kirsty said, we'll hang around for a few minutes as well. So you're welcome to kind of stay on and ask any questions, or you can drop us an email. But thank you very much.